Hello all, this is Dr. Dheeraj Mahasappu. Welcome to my channel. I am a consultant anesthesiologist specialized in neuroanesthesiology. So today I would like to tell you 10 mistakes that anesthesia students are doing during their post-graduation times. And even I did those mistakes, and now I would like to tell you one by one, which if you really correct during your post-graduation time, you can actually speed up your career. Okay, so let us start one by one. So number one is not having enough ICU exposure. So it's a very important thing. What happened is after I finished my MD, then I went to my town and applied for several jobs. After that, I got a job in a particular hospital where I need to cover one shift of intensive care, and I would be allotted some days where I can work in operating room. So the problem is I was actually good in operating room, but when I was supposed to cover the ICU, I was not very confident because maybe 1 or 2 months I worked in ICU during my MD time. So that is not enough. So what recommendation I would tell you is, or what I would have done in those days is, maybe after finishing the work in a hospital, evening actually I can go into the ICU, just have a look at patients. Like, if some sepsis patient is there, just look at what antibiotics are going on, what inotropes are going on, and what is the outcome. Because outcome is also important, because when you counsel a patient after your MD, you need to tell them whether it's going to recover or not. At least, roughly, you need to tell them. So, these kind of things you understand and get it only when you constantly see the patient on a regular basis. So, what is stopping you? Evening, be more proactive, put more effort during the MD. Evening, go to ICU. Even if you finish at 7, 7:15 or 7:30 or 8 o'clock, it takes hardly 10-15 minutes extra. Go to ICU. See some patients whom you're following up, and that would actually give you a lot of knowledge and exponentially grow your knowledge in intensive care, which will help you in your post-graduation, in a post-MD time. Okay, this is the number one mistake I did, and everyone does this, and this is a solution for that. So number two is not properly writing the logbook. Even I didn't write the logbook properly when I was doing my MD time. I just wrote the logbook just to pass the exam. But I have done a video recently, it's there in my channel, on how to write a logbook if you are planning to go to several different countries. But not only different countries, even if you plan to stay in India, if you have a very good logbook which shows you what type of cases you are doing and what type of surgeries you attended, what kind of complications and everything, if you are mentioning genuinely, then even if you apply in a good hospital, and if you don't perform well in the interview, by looking at the logbook, they'll actually appoint you. So for me, if somebody is coming and applying for a job and if he has a very good logbook with all charts and diagrams and everything of what he has done and images of some of the cases that he has performed, then I would surely, think that he is, surely different from other people who applied for the job. So that is how you differentiate yourself from others. So that is number two. So number three. So not selecting a thesis topic and not considering the thesis as a priority. So what happens is, as soon as you enter your post-graduation, you'll only focus upon, learning clinical skills, learning spinal, learning intubation, and quickly preparing some PPTs so that you can pass your exam, and inquiring about what books to read, inquiring about how the exam will be, and these kind of stuff will be done. What I suggest is, you can really stop all those things and focus on doing a good thesis. Why? Because if you really do a good thesis, it is not only going to teach you how to actually conduct research, and also since it's an original article, if you publish it later on, it will add a lot of value to your CV when you apply in other countries. And even if apply in corporate hospitals, if they see that you have done a very good study, then it adds a lot of value. So take thesis as a priority, and you try to, from day one, you start trying to actually make a very good study, try to find knowledge gap. And if you really don't know how to select a thesis, there is a video in my channel, how to select a thesis and how to do review of literature. Go through both the videos. I really explain them. Do it as a priority in the first 3 months. You finish off the selection and start collecting data. And once you finish the selection and start collecting data, it becomes normal for you. Hope you're understanding. So let's go to the next point. So focusing only on passing the exam with the fear of failure. So most of you, what happens is, you just focus on passing the exam. If you take the statistics of MD, people are appearing for MD exam, how many are actually failing? Zero. Maybe few people fail. They must be really bad, or they're arguing in the examination or something like that. But if you take DNB, previously the pass percentage is low, but now I'm looking at a very good pass percentage, at least in the hospitals which I know. So overall, what happened is passing exam is not a very difficult task, and there is no need of putting so much effort in actually passing the exam and understanding what books are good and all that. That is the old type of approach, I feel. Now your approach should be more about having a good logbook, having a good thesis, and having a good communication skills, understanding how to present in open forums. I think these kind of things you need to develop. Passing exam is important, but at the same time, that is not the only thing which decides your career after finishing your MD. Okay, let's go to the next point. So, not planning exams like IDAC. So, I have done videos on how to pass IDAC in the past, and there is a video on from the examiner's point of view. I actually invited a IDAC examiner who conducts your exam in UK. So, what I really feel is during your MD time, maybe in final year, you have to start preparing for IDAC and finish it. So, it will actually help you in going for your MD exam also, and it broadens up your knowledge, because I've seen the questions of IDAC and FRCA. The questions are asked in more detail, and they test your conceptual knowledge, the analytical skills. So those are the type of questions when you answer, your perception towards anesthesia also will change. So better to finish off some exams during your MD time. Maybe part 1 you can finish. So that's one thing you can do. Let's go to the next point. Not doing any observerships in good places. So during your MD time, most of the people in India actually go to observerships in, or what do you call it, you visit another place. For example, people in Bangalore, they go to Nimans for neuro, they go to Jayadeva for cardiac, like that in every place. They go to some place like CMC or some place for a 2-week period or 3-week period, or some place 1 month, they go for observerships. So that is a very, very good and very important thing you need to do. But why don't you go abroad? And I've done a video also on observerships in different countries. You can actually do 2-week observerships in some other countries, and you can actually even go to best universities in USA also and do observerships. So why don't you consider them? If money is a constraint, then rather than paying 15 lakhs, 20 lakhs per year in a private college, do a DNB and use that money. You don't even require that much of money. Maybe 3 to 5 lakhs are enough. You can use that money and do an observership in some other country and come back. Maybe that adds a lot of good value to your CV than paying so much of money and studying in some private medical college. Okay. Hope you're understanding what I'm trying to do. Let's go to the next point. So, not developing your CV during your MD time. So, what is developing the CV? CV should consist mainly your presentations and conferences. Maybe a poster is also good. So, a poster presentation should be there, and some podium presentations if possible. Along with that, 1 or 2 case reports or case CVs and your thesis. Usually people publish the thesis after finishing the MD, but during the MD you can do some case reports. Who's stopping you? So doing some research and doing some publications and presentations, and maybe you can get involved in some social service activities like Smile Train Initiative, where the cleft lip and cleft palate surgeries will be done in some other country. You can enroll your name in that. You get a lot of pediatric anesthesia exposure, and also it's a service kind of service activity. So, and you can actually get involved in some service organizations and work for them. In the process, you also gain some knowledge, and you'll also serve the community. Those kind of things actually add a lot to your CV. Recently, I've seen a CV from Philippines, a lady who applied for a fellowship under me, and I was amazed at looking at the CV. The kind of service activities she has done, nearly 10 to 20 service activities. Even I have not done any service activities. So that is the kind of thing you need to develop in your CV. Let's go to the next point. Focusing only on the procedures and not understanding how the consultants or assistant professors are planning the cases. So, most of you actually what you're trying to do is, I want a spinal chance, I want a chance to intubate, I want a chance to put an arterial line or a central line. This is what you ask. That is not the thing you need to ask your consultant or assistant professor, associate professor. What you need to ask is, how did you plan the case? What is the risk associated with this case? So how did you explain the risk to the patient? And then if you ask these kind of questions, they will feel like giving chances to you. So your consultant should feel like giving chance to you by looking at your commitment rather than you demanding them and taking off a chance. Because finally, you need to understand how we actually plan a case. So that is the most important thing you need to develop. I hope you understood the point. And the next point is public speaking skills. So most of you are not focusing on public speaking skills. Public speaking skills. So I'll tell you actually. So when you get a rota of your presentations in the hospital, why don't you make every presentation best, or at least 1 in 5 presentations? Why don't you do it in a good style? So basically, when you present something to audience, they should tell wow. I'm not telling each and every presentation of yours to be wow, but at least 1 in 5 you can make it. Use your skills, use your PowerPoint skills, rehearse multiple times, try to tell it in an engaging way. And if you practice like that, at least 1 in 5, if you do in that way, you will develop, you will learn the subject, at the same time you will also learn how to present. So this is a very important thing you need to develop. And there are different styles of presentations apart from PowerPoint. Prezi style of presentation is also there. You can just Google and know, Google and understand what is Prezi style of presentation. So basically, the how to engage somebody when you are giving a presentation is the most important thing. Even that you actually can develop during MD time, because you, after finishing MD, nobody will ask you to present anywhere. This is the only time you are given some roster of presentations, and you try to present. So when you have such an opportunity, why don't you use it in a proper way? So each and every presentation, if you try to do it in a good way, that will exponentially increase your skills of presentations. Hope you got the point. And last but not the least, getting a mentor. So among the faculty that you have, become close to some person and try to get mentored. See, most of us don't like if somebody is watching us, if somebody is telling you, don't spend money, if somebody is telling you not to do like this, if somebody is telling you, you will not usually like it, but that is what you need to do during your training time. You need to have a mentor who actually watches you closely and tells you you're doing wrong here, you're doing right here. You're supposed to lose some weight. You're supposed to do your thesis well. You're not collecting the data. Exam date is coming by. thesis submission date is coming by. So you need somebody to monitor you. So that actually drastically changes the way you actually do your post graduation. So try to get a mentor. So among your faculty, try to choose somebody who is a little close to you, and maybe you can discuss with them, and you can tell him that you're ready for being mentored. And they might actually take an initiative they really like, and they might mentor you. And if you really have a mentor, and that will actually change your life. You don't understand the power of mentorship. Hope you got what I'm telling. So these are the 10 things which I thought, if you really do during your post-graduation time, would drastically change the way your post-MD career is going to go. Okay, so and even if it is 50% of what I told, your post-MD career is going to skyrocket. So that's it guys for today, and hope you liked the video, and do share the video and subscribe to the channel. Dr. Dheeraj Masapur logging off. Roger that.